Hey guys, I'm Dr. Paulina, and today in my channel we're gonna be watching the first episode of Grey's Anatomy, and I'm gonna be breaking down some of the scenes that are some of my favorites and some that are just noteworthy, I would say. So let's go and get started.
The game. They say a person either has what it takes to play or they don't.
The game that Meredith talks about is kind of like the hustle that you have to have in order to kind of be successful in your medical training. If you're doing it just for the title or the money, you're gonna have a very rude awakening during residency.
No, seriously, you have to go. I'm late, which isn't what you want to be on your first day of work, so.
So, yeah, she's saying she's gonna be late, which is a big no-no, especially on your first day. And like, I've seen this a lot as a chief. I see residents that maybe get into the middle of their year and they get comfortable, and then they switch over to a new service, and it's like a whole different person that comes out.
Each of you comes here today hopeful, wanting in on the game. A month ago, you were in med school being taught by doctors. Today, you are the doctors.
So I love this episode because I feel like you always remember kind of like that first time people start calling you doctor. It takes a while for sure to like kind of own your new position and to not feel like an imposter, because you're just like, I was just a student. Like, how did I become a doctor?
Look around you. Say hello to your competition. 8 of you will switch to an easier specialty. 5 of you will crack under the pressure. 2 of you will be asked to leave.
So those statistics are very cruel. I don't know if that was just back then or what it's like now. It's very different on the medical side. I would say we were very conscious of the fact that like we were living through COVID, so everything was crazy and we really looked out for each other. So I think the culture has definitely shifted.
Only 6 women out of 20.
Yeah.
Definitely medicine is one of those male-dominated fields. Once you get down to like your surgical categories, those are also male-dominated as well. But pediatrics, I think, is kind of the exception to that. I feel like I work mostly with women on the pediatric side, although I know some wonderful general pediatricians who are male.
I have 5 rules, memorize them. Rule number 1, don't bother sucking up. I already hate you, that's not gonna change.
Dr. Bailey here is the senior resident, so she has more experience than they do. They're the interns. They're supposed to be kind of like working for her, but this interaction would be considered inappropriate. Like, I could be charged with misconduct. You just don't talk to junior residents that way.
Yes.
You said 5 rules, that was only 4.
Rule number 5, when I move, you move.
One mistake that I made once was I forgot that I couldn't take the elevator, and I'm like sitting there pressing the elevator button, and my senior runs past me. He's like, "What are you doing? Like, we have to take the stairs." And I was like, oh my gosh, so embarrassed.
What do we got?
Katie Bryce, 15-year-old female, new onset seizures, intermittent for the past week. IV lost en route, started grand mal seizing as we descended.
This patient is having a seizure, so they're unconscious, they're not responding, they're having tonic-clonic jerking of the upper extremities and lower extremities. And usually in this situation, the most important thing is to abort the seizure. The way to do that is to give benzodiazepine, because if the seizure gets prolonged, then you're looking at a period of time where the brain is not getting oxygen, and that can lead to irreversible damage to the brain.
Tox screen. Christina, you're on labs. George, patient workups. Meredith, get Katie for a CT. She's your responsibility now.
Wait, what about me?
Honey, you get to do rectal exams.
The rectal exam, unfortunately, this is something that I feel like it's a rite of passage for everybody. You'll have to do it at some point in your training. I would just say, use one finger, that's all you need, and lots of lube.
If you don't count the fact that my bacon days are over, sure.
So bypass surgery tomorrow with Dr. Burke. I hear he's good. And after that, you can have all the bacon-flavored soy product you can eat.
Looks like O'Malley's working up a patient who's gonna have heart procedure. So CABG is coronary artery bypass graft, where basically the surgeon has to bypass a blockage in one of the coronary arteries and basically attach it to another part so that they can restore flow to the heart. And the reason why this happens is atherosclerosis. So telling him that he can eat burgers after his surgery is probably not the best advice and not something I would recommend.
Are you sure that's the right diagnosis?
Well, I don't know. I'm only an intern. Here's an idea. Why don't you go spend 4 years in med school and then let me know if it's the right diagnosis? She's short of breath. She's got fever. She's post-op. Start the antibiotics.
This is like one of my least favorite scenes in the first episode because I feel like Karev is just so condescending in this one, and unfortunately I have had experiences with junior doctors kind of like this where they're like, you know, they were top of their class, they're super smart, you know, they think they know everything, but it's like you don't have the clinical acumen yet to really know like the nuances of different clinical scenarios. This is real life now. It's not just like taking a test. Not just that, but just like the way he talked to the nurse, I think is really rude. And usually when the nurse is questioning you, especially like an older nurse, like, are you sure you want to do that? Usually that should tell you that you're about to do something wrong, so you should maybe just double check with somebody before you take your next step.
She's having multiple grand mal seizures. Now, how do you want to proceed?
So this is definitely one of like the scarier scenes watching as a resident. Thankfully for my first code, I was not alone. I had a senior with me because the way it worked was that the code blue pager was carried by our senior, and then we carried like a backup pager as the intern. So the senior would always be right there. After each code, no matter who's in it or what's happening, we usually do like a debrief. So the whole team gets together and they talk about like what went right in the code, what are some things that we can improve next time, what are some resources that we need, whatever it may be.
Anything? I see sinus rhythm.
So sinus rhythm means that the heart rate is back and it's not like an aberrant rhythm, it's coming from the normal pacemaker of the heart. And once you have a rhythm, again, go through your ABCs, airway, breathing, circulation, and you want to try to figure out what happened that led to the cardiac arrest.
I'm saying that I don't know.
Well, what do you think it could be?
I don't know.
When will you know?
I don't have an answer for you. For now, Katie is stable.
Wait one damn minute.
So this is hard to watch because I feel like people sometimes have this perception of doctors like, you know, like you're supposed to know the answers. You're the doctor here. Like, why aren't you doing your job? One thing I like about this scene is that Derek says, I don't know. And I think that it takes a strong doctor to say that because, again, you never want to mislead a family and say like, well, I think it's this and blah, 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 because then they're going to hang on to that. When it turns out to not be true, they're not going to trust you anymore. So I think like being very transparent when you're having these conversations with families is really important.
I put you on a bypass machine, which pumps blood for your heart. Fix your ticker, take you off the machine, I'm done. Simple procedure.
He says it's a simple procedure. Like, I've been in some CABG cases that were like 9-10 hours long. But yeah, it's not really a simple procedure.
So, I shouldn't worry?
I'm very good at what I do. It still is surgery. There are some risks.
Honestly, like seeing what surgeons do and seeing surgery as a medical student, I would always say like I would never advise to have surgery unless it's going to save my life or save a limb.
See you after.
He'll be fine, right?
You have nothing to worry about. Promise.
You never want to promise anything in medicine, even if it's an outcome, if it's timing for sure, never, like things never run on time in the hospital.
I'm gonna do something pretty rare for a surgeon. I'm gonna ask interns for help. I've got this kid, Katie Bryce. Right now, she's a mystery.
When we have difficult cases like this, we usually will present the patient to grand rounds. You will typically review the case, go through all the imaging, the labs, and ask everyone in the room, all the surgeons, like, what are your thoughts? What would you guys do? Any diagnosis that we need to entertain that we haven't already? So they're doing the cabbage, and now it looks like they're shocking the heart. They have the internal paddles. And I think he's calling time of death.
I have to let him go. It happens rarely, but it does happen. The worst part of the game.
I would say it is kind of rare. I feel like we have a really strict screening criteria for whether they would be a good surgical candidate.
I wish I wanted to be a chef, or a ski instructor, or a kindergarten teacher.
I think after a long day, sometimes of being a doctor, you're just like, why am I here again? This is a really hard job. I could be doing a normal job like everyone else where it's not so stressful.
When I told my mother I wanted to go to medical school, she tried to talk me out of it.
You have to understand that this is really hard. You basically have to give up a lot. You have to sacrifice a lot, but if this is truly what you want to do, you should do it. And I would say one piece of advice that kind of stuck out to me was one physician told me, like, I would never tell anyone to be a doctor, but she's like, I would always also never discourage someone from being a doctor. So like, it's a hard life. It's not something that I would be like to my kids, like, you have to be a doctor. Like, I think you have to choose this profession in order to be successful in it. That's really what gets you through.
All right, everybody, it's a beautiful night to save lives.
Yeah, sometimes I think about Derek's line because it feels like in residency, you're just like going through the motions sometimes, but you have to kind of come back to yourself and remember like what the work that you're doing is important for somebody, and you have to put the best foot forward of yourself to make sure that you're doing the best for them.
There comes a moment when it's more than just a game.
When you're actively doing something that is saving somebody's life, it just like kind of also shocks you into reality. Like, what I'm doing is a privilege. There is no one else in the world that is going to like be in this room right now that is going to make the decisions that I'm going to make for this patient to live. And I think that anytime I run a code or anything like that, like I always come back to that moment, like, of realization that this is why I do this, is to heal people, to help people, to give people another chance, basically.
And you either take that step forward or turn around and walk away.
So just a quick story. One of the first things I was allowed to do in the OR was to scrub. Was to scrub in. And basically what that means is you get into like you get sterile, and you put your gloves in, you put your gown and everything, and you have to not break the field basically. And I just stood there. I just stood at the OR table, and like my job was to stay sterile, and that was the first thing I did as a student.
I could quit, but here's the thing. I love the playing field.
I would say, like, you know, for surgeons, I think that there's a lot of adrenaline that goes into some of these procedures, and that's probably what keeps them going. For me, I think it's more of an intellectual pursuit. I think for me, it's like building on the things that I already know to make my knowledge base more fine, more specified, to the point where if somebody were to ask me a question about the cardiovascular system in a pediatric patient, I would have that answer, because that is a very fine set of skills and knowledge. And I think that that is like my biggest challenge right now that I've finished residency and now I'm moved on to fellowship. But I think overall, I love this episode because I think when a lot of med students watch this, initially they're like, oh yeah, I want to be a surgeon and like feel that rush. But there's other things that you can do in medicine to kind of get that sense of satisfaction. And thankfully for me, it was cardiology. I definitely went through a phase where I thought I'd be a surgeon, but after a long surgery rotation, I decided that was probably not the best route for me, and I went for the medicine route. So that's it for today's episode of Grey's Anatomy. It's a good one. It's an oldie but a goodie. If you like this kind of content, make sure that you like, share, and subscribe, and I will see you in the next one. Bye now.